And we will go ahead and get started. All right, hello and welcome everyone. We're so glad to see you all here today for today's Health Speaker Series with the Pacific North Chapter of the Medical Library Association and the Network of the National Library of Medicine Region 5. These two groups have been collaborating on this webinar series for the past few years to highlight topics of interest to you, our attendees. I'm Emily Hamster. I'm the Assistant Director for the Network of the National Library of Medicine Region 5, and I'll be hosting today's session. With me is my colleague, Carolyn Martin, who will be supporting us with technical needs and monitoring the chat throughout the session. Today, we'll be learning about the Pediatric Pandemic Network and their database, Resource Central. Before we get started, just a few things we need to cover. You've all been muted as you join the webinar, and you're welcome to put your questions and your comments in the chat. We love an active chat during these sessions, so use that chat feature throughout the session. If you aren't familiar with the chat, it's the bubble at the bottom of your screen, kind of towards the middle left. Please make sure that your chats and your questions and comments, they're going to everyone, not to a specific participant, so that we can all participate in the conversation together. Closed captioning is available at the bottom of your screen. And so you're going to click Show Captions, the Show Captions icon if you want to use that. We're offering two different types of CE for today's session, both Medical Library Association CE and CHESS CE. And CHESS is Certified Health Education Specialist, if you're not familiar with that. We'll be providing a link to an evaluation at the end of the session, and that link includes information about how to claim your CE for MLA and for CHESS. So stay on for the end of the session, and we'll give that to you. But keep in mind, whether or not you're claiming CE, we'd still love it if you filled out the evaluation at the end of the session. All right, so we're very excited for today's webinar. We have two speakers who I'll introduce to you now. Dr. Paul Stengel is the Director of Education for the Pediatric Pandemic Network, where he leads national strategies to advance disaster preparedness and everyday emergency readiness through evidence-based education and resource dissemination. He oversees Resource Central, a librarian-curated, subject matter expert reviewed database of more than 4,000 resources that support healthcare professionals, families, and schools in accessing, organizing, and sharing trusted preparedness information. With expertise in instructional design, learning science, and workforce enablement, Dr. Stengel specializes in translating complex evidence into practical tools that strengthen health literacy, support informed decision-making, and enhance community resilience nationwide. And also joining us is Christine Willis. Christine is a clinical information librarian at Children's Healthcare of Atlanta, where she provides expert research support to clinicians and advances evidence-based practice. Her expertise includes health literacy, accessible library services, and teaching healthcare professionals how to efficiently locate and evaluate high-quality research for clinical and community application. She is a published author, national presenter, a contributor to MS Focus, a column editor for the Journal of Hospital Librarianship, and a senior member of the Academy of Health Information Professionals, or as we know it in library land, AHIP. Paul and Christine, welcome, and we look forward to your presentation. So you can now share your slides. Oops.
All right, thank you for the introduction. Everyone can see my slides fine? Excellent. So yes, thank you for having us here. We're here to talk about the Resource Central database, which is a project of the Pediatric Pandemic Network. To get started, uh, the content presented here and throughout the presentation is that of the authors and does not necessarily represent the official views of nor an endorsement by HRSA, HHS, or the US government. After completing this interactive webinar, attendees will be able to explain the role of the Pediatric Pandemic Network and Resource Central in improving access to evidence-informed disaster preparedness and everyday readiness resources for healthcare professionals, families, and schools, demonstrate effective strategies for locating, filtering, and organizing audience-specific preparedness resources within Resource Central to support health education and community outreach, and apply curated collections, resource guides, and AI-assisted tools to identify and disseminate trusted disaster preparedness information that supports informed decision-making and health literacy in clinical and community settings. At the PPN, we believe all children deserve access to high-quality care. Therefore, our network aims to empower healthcare systems and communities to provide high-quality care to children every day and in crisis. We have 6 overarching goals that guide everything we do. We expand children's hospital partnerships with local, state, regional, and national emergency preparedness systems. We collaborate with community and other pediatric partners. We improve the pediatric emergency readiness of healthcare systems, including hospitals and pre-hospital systems. We increase the capability of telehealth systems utilization in disasters. We accelerate the development and dissemination of research-informed pediatric care, and we coordinate the research-informed responses to disaster and health threats impacting children. Today, we will focus on how Resource Central Database Project accelerates the development and dissemination of research-informed pediatric care. The PPN is a collaborative agreement of 14 hospitals across the country, each providing expert superpowers to 3 key areas of the work: service corps, everyday domains, and disaster domains. Service corps provide expert support to various functional categories like analytics, evaluation, and research. Everyday domains focus on topic areas related to the everyday readiness of pediatric care, while disaster domains focus on topic areas related to emergency management and disaster response. Putting all of this together, Resource Central is a database maintained by the Education Service Corps with the aim to support everyday and disaster domains in the curation and collection of resources related to providing high-quality care to children every day and in crises. And if it's not in the database, that is a good reason to then leverage our 3 pillars of experts to identify the need of the resource, create it, and then add it to the database. Now that you know a little bit about the Pediatric Pandemic Network, let's learn a bit about you. If someone asked you for resources to help prepare for a disaster at a school, where would you begin your search? Please use the chat to answer the question. Google, yeah. ChatGPT. Ready.gov, nice. FEMA. Okay, some I haven't heard of here. So good ones. Okay. So for many of us, a search for disaster management in schools toolkit may begin with Google. So here I put that in very recently, and this is what I got. I got a sponsored result, right? Which probably needs to be vetted for motivation and funding source. And I also got an AI overview, which consists of several sources and an algorithm that prioritizes speed over accuracy, most likely. And both require the person searching has expertise to vet the content, right? And it can be complicated. In July of 2021, the PPN grant narrative identified that the process of finding high quality pediatric disaster education was fragmented and overwhelming. Today, this overwhelm and fragmentation has only gotten worse by the introduction of generative AI. Largely unregulated, there is evidence that it is relatively easy to get generative AI platforms to index misinformation. Compounding this issue, Google searches are indexing generative AI chats that are publicly shared and created a loop of low quality content that is mixed with high quality content in search results. In 2026, Resource Central is positioned to address these issues. And by 2027, we hope to reduce the time it takes to find high quality resources, mitigate the duplication of content across regions, and generate a shared intelligence about what improves practice. So I'm going to turn it over to Christine to continue with this.
So, as we've been sharing, and you likely know from your own experience, Google optimizes their search results based on popularity, search engine optimization, advertisement, and promotes results for engagement. AI has been trained to optimize for probability, pattern recognition, and speed. So users want the most likely, easiest to read, and quickest response, it seems. But we are now sharing Resource Central with you, and it is a very specific database that focuses on accuracy in search results, attributes to the source front and center, and every resource undergoes librarian and subject matter expert review. The resources are aligned with HRSA and per our grant, and they're very specific to pediatrics. But the Resource Central database is not a file repository. We do not host documents, but we link to them. And so therefore, we're not a competing platform, but we're working with content experts. We have a lot of information from partner sites, but we are not a replacement for those sites. Resource Central does not have communication channels embedded, but we do welcome suggestions. However, Resource Central is a discovery database that you can trust. The content can be used to coordinate responses for emergencies, and we've integrated an acceleration infrastructure to work with our AI, which we will share more about in a few minutes. But for now, we want to discuss our core activities.
I'm sorry.
No, you're fine. So PPN has 4 core activities that are our superpowers for Resource Central. It's one place to provide training, support, and tools from a variety of experts on topics specific to disasters. We seek to share the best practices for this specific population and encourage collaboration between various experts and groups who are involved with disaster planning, response, mitigation, and recovery. And finally, a Resource Central is working to align priorities and strategies in this space. So how are we doing this? We're doing this by providing training, support, and tools. The Resource Central has reviewed over 4,000 records. They comprise various educational formats, including modules, demonstrations, toolkits, simulations, exercises, and more. We make them available for discovery in a single place without the risk of misinformation and disinformation. Recently, Resource Central has launched an RC 3.0, a generative AI research assistant chatbot that answers questions users may have about specific records, or broad questions as well, that draw on the entire database of extracted records to generate a personalized answer with references. And we will walk you through that in a little bit. It is very exciting to see. And then finally, our team of librarians and subject matter experts are available upon request to complete literature reviews for certain topics. But today we're sharing some of our best practices. So the PPN team collaborates with domains and partners to create resource collections and guides based on selecting the best of the best on key topics critical to the mission and often timely to events of the day. So for example, we recently put together a collection on pediatric readiness studies, as well as a camp director's preparedness resource guide. So these best practice resources feature links to the best of the best resources from over 500 institutions represented in the databases. So right now we have more than 40 guides available. They're organized by audience, focus area, seasonal calendar, and they're printed on one page, very easy. We'll show you that in a minute to use. And then we have more than 30 resource collections available. And those, again, are organized by institution and continuing education. So everything starts with a single record. And when a user finds something they like, the record always provides a link that takes the user to the institution's website. And we see this as well, it takes it to the other records that are involved with that, but you can see the institution. We see this as a win-win because our users have access to the best content on the topics that interest them, and our partners get a direct referral to their site if they're going to go back and look. This also ensures our partners have complete control over the visioning and accessibility of their own content. We recently released branded institution resource collections and are working with institutions to partner with us to curate their collection page by providing a logo and page description. So we're rolling out analytics for institutional records, and that hopes to be done by the end of the quarter. So we have a lot of strategy with this, connecting the partners' repositories and making information accessible. We have a system in place. You can imagine working with some librarians. We have a system. And all of our records are submitted to Resource Central. They're vetted by our SMEs and who are affiliated with the network hubs and the content domains throughout PPN. Our guidelines for vetting are posted on our website, and our rejection rate is about 10%, and usually based on submissions that are not germane to our topics that we cover, and from sources that we wouldn't see as primary. Once approved, librarians apply metadata to every record. Tags reflect the strategic priority areas of the PPN and partners. And this ensures that resources are the highest quality, aligned with the priority area of pediatric disaster and everyday readiness policy and scholarship. So they're easy to search, they're filtered, and they're organized in personalized ways. So now Paul is going to orient you to our login process. You can get started with some searching.
Thank you, Christine. Yeah, so I have a QR code on the bottom left there. You can use your phone if you want to, or you can go to the URL that is in the chat and also on the slide here, resources.peacepandemicnetwork.org. And over on the right, there'll be a little login button for you to click, right, highlighting it here on the slide. And once you click on that, you will be brought to a sign up page. And in the sign up page, there is a sign up now button that you want to click or a link you want to click there. And when you click on that, you'll be able to put in your email address and there'll be a button to send a verification code to your email. So you have to verify your email for security. And we'll change to a profile button and you'll be able to see your email and all of the menu items that come along with being logged in. So give everyone a minute to log in. And then we'll have some fun because there are additional features that you get when you log in, like saving your searches and bookmarking records. And RC actually will remember your chat history. So if you're interested in trying out the chatbot, it will remember your chat history rather than starting anew every time. Sure. Login button right in the upper right-hand corner. And then make sure to click on the sign up now if you don't already have a login. Okay, I'm going to go ahead and proceed. So you can do this without logging in too if you want to log in later. Um, So if you go ahead and go to the home page and you type in a keyword search here. Here I'm going to continue with our theme. Disaster Management in Schools Toolkit is what I put in. And when you put in your keyword or your phrase, this searches the record title, description, medical subject heading terms, and other tags for results. And you can narrow your search by putting your keywords in parentheses. So you'll notice that your search results will change when you narrow it using the parentheses. So that's just a tip. And then go ahead and click on the magnifying glass, and you will be presented with a search results page. And I want to talk a little bit about what makes up a search results page. So on a search results page, you're going to get the number of results. You're going to also see if there are any resource guides that have records that are relevant to your search results. Those will show up at the top almost as like sponsored results. You can narrow your search results. There are a number of facets. Here I'm highlighting the audience area. So you could say, just show me all of the results for disaster management in schools toolkit and check the nurses box. And you'll be able to see the ones that are for nurses, maybe even school nurses, right? I think we have some in there. And you're also able to bookmark. So if you kind of skim through all of your results and you like the titles of certain things, but you don't want to click in, you just kind of want to look through everything and pick the best of the best of maybe like 100 results, you can click this bookmark button and it will add it to a screen where all of your bookmarked records are. And I'll show you where to find or how to find that in a minute. This only works if you're logged in. And then you can also save the search. So if you really like the combination of keywords and filters that you've added, you can save the search. And I'll also show you where you can find that as well in a minute. And once you're done sort of interacting with this search results page, you can always access a resource directly by clicking on this Access Toolkit button, and that will take you directly to the partner's website. If you click on the title of that listing, then it will take you to the full record where you can see more metadata on it. So you really have two options there. So when you're logged in and you've started to bookmark some of your searches, you'll be able to see a screen under your profile area where you'll be able to see all of your bookmark searches right from that screen, and you can view the resources directly from there. This is almost like having a shopping cart of records. You can also view from your profile save searches, and this is what the save search screen looks like. And from here, you can see the keywords and the facets that you use, the tags that you use, as well as any notes that you left for why that particular search was something that you wanted to save. So it's a nice little feature you get when you log in. I'm going to turn it over to Christine, who's going to talk a little bit about this poll question.
And I see in our chat, we might be moving a little fast. So we'll give you just a second, maybe like 20, 30 seconds here to just kind of finalize looking at that search screen. And you guys can read this question, our poll question, and start thinking about how you want to respond to it in the chat. So do you often get asked to summarize and synthesize information to help people make decisions? And then what are you expected to share in that summary? I know sometimes as librarians, our clinicians just want a list of articles for them to review, but then sometimes they want us to kind of give them an overview of what we found. So that's kind of what we're looking at. Do you get asked to do that or something different? So we'll give you a minute and you can finish up your login, finish up looking at the site, and share some examples of when you've done this. So a lot of people don't get asked to summarize, which is typical, I think, for some hospital librarians and things. Most important thing to consider, dissemination of emergency information to different stakeholders. Andrea says, I haven't been asked to summarize. More likely to be asked to do the search for the person who will do the summary for the C-suite. Okay. Kim is asked to find information to help write grants and inform the programming. So not always asked to summarize the information. Yes, Elaine. With AI, we may need to up our ante. Well, we are going to help you a little bit in that. So we can see if anyone else has anything.
Yeah. Let me know when you think I can advance the slide when you think we're ready.
We'll go on.
That's a good
Oh,
try.
someone's standing up a role at a library at the Children's Hospital Wisconsin Family Resource Center. Yes, this will be a great resource for that manager. And we have a lot of family and children's specific materials too to help families prepare. We can move on.
Okay.
So we're trying to help you with this summary and by creating a few resource guides and collections that you've heard us mention here a few times. And so our resource collections are a searchable list of resources that share a common theme. And the guides are expertly curated and they're visually stunning, in our opinion. And they're highly shareable content that focuses on topics identified by Pediatric Pandemic Network as critical to improving readiness for healthcare systems. Pediatric readiness, for sure. So this is what our resource guide page looks like. If you click on the guide's name title along the top. They're organized by audience, focus area, and seasonal calendar. And each resource guide includes a persistent link, a printable page, and a QR code designed to accelerate real-time dissemination of research-informed pediatric care. So you can see that you can do this by alphabet and jump down to the S's. We're sticking with our school nurse guide here. So it's found in the S's. We have a link that you can share that section with someone else. So it makes it really easy to just pop that into an email and go. And then once you click on the Browse Resources button, you will get the guide itself. And typically there are 6 resources for each of these guides with a note on the page with a hyperlink to search for more resources on that topic. So you can see that in this example. You see a short description of the resources and where they came from as well. So this is what the one page looks like. It has the persistent link, it has QR code. So this is something that if you were doing a disaster awareness promotion for a month, you could easily print one of these and post it on a bulletin board outside your library or in your library, use them as handouts, things like that. The information is all there and easily reproducible. So, and we point out that the source is noted clearly on these guides. So for our resource collections, they are also a searchable list of resources with a common theme, and they're organized by topic in institution, continuing education. So many of the collections on Resource Central have been co-created by our team and network partners, and you can contact us if you'd like to add a resource to an existing collection or have an idea for a new one. And I see someone in the chat has mentioned measles. We have measles information. Oh, and this is another screenshot of collections, same as the guides. You can share the section of it, and then you will then see the browse resources option as well to get into the collection to look at. And this is what that looks like. You can search within this screen. It is filtered already for school nurse information, and you can pull together the requested information to then utilize our AI tool. So Paul will now tell you about RC.
Exciting. Thank you, Christine. So, in some cases, you may not find the resources you are looking for through keyword searches or guides or collections and can use a little personalized help. RC is our rules-based chatbot designed to assist users in finding the content they need. Here, we put the same search in as before, but this time we click on the Ask RC button. Allow me to take a moment to explain what happens when a search is sent to RC. A traditional generative AI chat is optimized for probability, pattern prediction, and speed. RC also leverages probability and pattern prediction, but it adds a rules-based layer to ensure accuracy, HRSA-aligned mission, and pediatric specificity, that you won't find with other chatbots. RC's technology is based on a retrieval augmented generation architecture. This means that it combines the strengths of retrieval-based models with generative models to improve the accuracy and relevancy of generative text. So it is constrained to only the resources in Resource Central database. Access speed depends on the accuracy of the content extracted, record descriptions, and tags on each record, and it completes 2 round trips between the chatbot and the LLM to check against rules and ensure accuracy. Here you can see the results when asking RC Research Assistant for a disaster management in schools toolkit. Sources are provided in line and at the end as references. Click on the links to see records and Resource Central used to generate the personalized response. Next, you can see here I follow up and ask RC to further personalize the response for my context. Here I'm mentioning that I'm a school nurse and that I want to create a tabletop simulation for my district in Connecticut, and that I want to be able to bring this to an administrator and pitch professional development around this. That, by the way, does not exist at all in Resource Central as an individual record, but RC is able to take existing records that are extracted and create a custom tabletop exercise for me that I can then download as a PDF and I can use as is, or I can put into a word processing document and continue to edit and personalize. All right, that's the end of our presentation. Any questions for us?
We had a good question in the chat, and I gave a little bit of an answer, but Paul might want to expand on it. So it was from Elaine asking, I understand most of the materials are specific to pediatrics. What age group does that include? And also, how do you decide to include more general disaster prep info? So we don't have an exact range, like how PubMed has check marks for certain age groups, but generally under 18.
Yeah, under 8, yeah. We have infants all the way up, yep, to pediatrics, I think even goes beyond 18, right? And we also, how do we decide to include general disaster prep info? I think anything that would support a family in making sure that a kid is safe in a disaster and everyday emergency is how we decide what makes it into Resource Central. If it's something that's very broadly disaster focused and it doesn't really have that angle of supporting kids, there are other repositories for that. I think that Asper Tracy is a really good one, and others. So we're really focusing on the pediatric aspect.
So another question that we have in the chat is, how long have you been working on PPN and when did you add the AI chatbot?
Great question. So the Pediatric Pandemic Network has been around for, we're coming up on 5 years now. I started in 2022, and the chatbot has been around for a couple of years. It is definitely our most sort of experimental feature, and we're always adding new features to it. It's due for an update later this year. How many staff support the curation and upkeep? I'm going to assume not a PPN, but a Resource Central. Resource Central isn't, PPN is much bigger than a Resource. Yeah, it's much bigger than Resource Central. But of Resource Central, I mean, okay, yes. Um, it's mostly part-time people who are working on it, but I would say, we have maybe four subject matter experts, four librarians. I am the project manager for all of that, but I have other sort of duties as well. So I don't know, maybe 10, but not like 10 full-time people.
And a question that came up while you were talking about the age range of the resources. So all of the resources are aimed at the needs of people 18 years of age and younger.
Roughly, yeah. I mean,
Okay.
we're really focusing on the pediatric disaster and everyday readiness space and ensuring that, people who are responsible for making sure children are safe in those contexts have the resources that they need. And that can be a healthcare professional, that can be a school professional, that could be a parent or a caregiver.
And related to that, one thing that I really like about the search is the different limiting by audience. And how do you go about uh, evaluating the audience and applying those? Um, like when you're evaluating the resources,
Yeah.
what criteria do you use to evaluate who the audience is?
Christine, do you want to take that question? I mean, I think you might be able to translate it into a librarian frame.
Yeah. Well, a lot of it is looking at the source, who produced it, who was their intended audience. And then some of it is us looking at it and reading it and saying, oh, no, actually, this could be helpful for a family and a physician. So it's somewhat judgment, experience and judgment. And then some of it is based on, you know, an actual evaluation of the content. Yes.
Yeah, we take our time
Yeah.
and we meet once a week and debate the more challenging records if we have a hard time figuring out how we're going to label it or whether it makes sense within, the mission of Resource Central and the Pediatric Pandemic Network. I think we average about 20 records a week. So we're doing okay there. And that includes sending them off and having them sort of reviewed at a higher level, at a HRSA level as well. So there are many checks and balances for making sure that the things that we're labeling and the things that make it into the database make sense for what we're all trying to do for the Pediatric Pandemic Network.
So there's a comment in the chat that I'm going to read out loud that someone just asked for some general info on life-threatening conditions for the school nurse and then asked it to create a tabletop disaster scenario. And it did based on the info provided. This is a great tool for professional development and scenario practices. So it's a great application. Okay, another question in the chat. Does anyone have ideas about how to promote the PPN within the hospital, perhaps with inviting key nurses to view this presentation?
I love that question.
Yeah.
I think yeah, there you go. Rachel, our communications director. It's like, yes, let's talk about that. I agree. Yes, I think that that is the model of the PPN, which is to have these, I mentioned those 14 hub hospitals work with spoke hospitals in critical access areas and rural areas all over the country to get the resources that are being made out there. So that is exactly within the spirit of the PPN. And there are lots of different ways to do that. I think it's regionally specific. So I think the first step is to like really understand the region and the context and the connections between the hub hospitals and spokes, and there's probably going to be a different strategy. So I think it's great that Rachel will connect. And then Shailene has been doing a lot of that work in Region 1 with our Yale hub site. So Shailene may also be somebody that, if anyone wants to connect with, I'm sure she'd be very helpful.
As I was looking around on the site while you were leading us through the search scenarios, I noticed that people can submit a resource to PPN or to be included in Resource Central. So could you talk a little bit about that? And there might be some folks here who have resources that they would like to submit and share.
Yes, so we have a submission form on Resource Central, and you can submit one or you can submit a bundle of resources. There's a description area where you can add a description that you think might be useful. You can also just write us little messages about how you think this thing might be useful. And then what happens is it goes into a workflow that then Christine or other librarians look at and begin the process of, labeling, looking at the resource, labeling it, and then creating, a record that can be reviewed by the SMEs. And we went over that all those multi-step processes. But generally speaking, we do have on our website as well submission guidelines. So if you're kind of wondering whether or not the thing that you want to submit might be relevant, you could look at those submission guidelines. They kind of lay out what is within the space. But if you want to just send us anything, we'll take anything. And if we don't accept it, we have a whole process of filling out a rubric for why it wasn't accepted. And then you'll get an email that kind of explains it. And we're happy to always have conversations after that as well. And I think Christine mentioned that we're like a 10% rejection rate. It's not super high, but and it's usually because it's just not pediatric related. It's disaster related, but it's not pediatric related enough is probably one of the highest reasons we reject.
Well, kudos to you for transparency too and following up with people on the resources that they submit.
Thank you.
Okay, the chat, I'm having a hard time keeping up. Lots of great questions and comments in the chat. Let's see. So a comment from someone who went through Hurricane Helene in 2024, and I will definitely promote this to our regional providers and my colleagues who are school nurses. So thank you for doing that. Okay, well, we give the chat another minute. I'm going to share some information about claiming the continuing education credits. So we'll switch to that, and then we'll go back to the Q&A. And so I see some more questions coming in for Paul and Christine. So we'll go back to those.
Yeah, if I just wanted to summarize if that's okay.
Yeah, sure.
So here we have this call to action slide. And I want to just say, back in 2021, it was identified that it was very hard to find high quality pediatric education and that it was fragmented, the process of finding overwhelming. With Resource Central, we've really worked to build an infrastructure that turns that fragmentation into coordinated discovery. And we hope that with your help, we can amplify this work nationally, reduce the time it takes to find high quality resources, mitigate the duplication of content across regions, and generate a shared intelligence about what improves practice. And we hope that you will join us in the mission to empower healthcare systems and communities to provide high quality care to children every day and in crises. So we have our Resource Central link there, and we also have a learning management system where there are a lot, one of the things I had mentioned during the presentation is that if something isn't already available, we make things as well. PPN Learn has lots of learning resources that are both open access and self-enrollment. So check those out if you know that there are a population of folks who are interested in going through, different kinds of trainings, videos, webinars, and we offer continuing education to physicians and nurses and other folks through that process as well.
Thank you. And Paul, could we get those slides after the session and share them?
Absolutely.
Okay, so everyone who's here, you'll get a link with those slides and resources so you can dig into those later. Okay, I'm going to share the CE information and then we've got a few more questions for Paul and Christine. So let me get that up here. Okay, so this session we're providing CE for MLA and for chess. So Carolyn just put the link in the chat box. The information for claiming your CE is in that link. So for both MLA and for chess. For MLA, you'll just have to click yes that you want the MLA CE in the evaluation, and it will lead you through the process. For chess, you will need to select that you want chess credit for the session and provide your chess ID. For chess, you'll receive an email confirming that you claimed your credit for this course. And if you have any questions about claiming CE for this class, you can email me at nnlm@uw.edu. And again, whether or not you're claiming CE for this session, we'd love to hear from you through the evaluation. And while I still have my slides up, we'll just do this slide and then we'll go to the Q&A. So we are recording this session and you'll receive an email with the recording and the slides after the session. We don't have any health speaker series planned, but we have ideas and we're hoping that there will be more sessions in this series coming this summer. But in the meanwhile, you can enjoy the recordings of the previous sessions in the series. Those are all posted to YouTube and you can find them on nnlm.gov. Okay, so I'm gonna stop here and we'll go back to the Q&A. Okay.
We did have a question about examples of multilingual materials that are available. So I put an example of a search in the chat there for that person. But you can see when you pull up a record, you're able to, I don't know if you want to click on that link or not, but you can see that the resources are tagged with the different languages. And then if they select the button with the specific language, so Spanish, for example, it will take you to the resource in Spanish.
Yeah, I think we have like 10 languages represented right now, but Spanish, French, Chinese, and Arabic are most. If you scroll down, sorry.
Yeah, so you can see on that second one, or there's two access summary buttons, and one has EN and one has ES. So if you click the ES one, it would take you to the Spanish version of that site.
Oh, that's excellent. Thank you.
So we're not actually translating any of the information ourselves. We are just linking to information that is already available translated.
It's a great question about vetting for quality. I mean, they are, I think one way that we look at it is that they're typically coming from well-known sources, right? So, that's one, I think, quality marker. Um, and our librarian team also, I think, has a sense of what is quality in their training, right? They've been trained to kind of look for, you know, where a source is coming from and what bias might be there. So we have that level of subject matter knowledge for identifying quality, librarians, professional opinion about that. And then we also have subject matter experts, right? So we have pediatrician doctors who work on our team who look through all of the records as well and identify quality. So, while identifying quality, I think, is a little bit of an art and a little bit of a science. I think having those different perspectives, professional perspectives, works as a pretty good filter. And then finally, nothing gets posted until it goes through also a HRSA review. So there's a level of quality review there as well. So there's really at least 3 checks for quality.
So a couple other comments I'm going to highlight in the chat. One attendee says, I established the Librarian Reserve Corps as an information response to COVID, which has been dormant since. I'm hoping that such a thing will not be required in the next infectious disease outbreak, but would be happy to talk more about it. So there's an offer there in the chat to learn more about that. And then we have another attendee who's added PPN Resource Central to their pediatric department LibGuide. So excellent. Action that you can all take after
Mhm.
this session is to add this resource to your resource guides.
Any help there would be great. We really want to get this out to different folks. So thank you, Fred. Couldn't have done it without Christine and the National Libraries of Medicine, which every librarian I think on our team came from there because we posted on the listserv, right? So couldn't have done it with all of you. We had it 3 months without librarians and we didn't really move very far. So it became really clear that they were the engine of Resource Central.
All right, it feels like we're winding down. If there are any questions that I've missed, somebody please re-ask it in the chat or highlight it. I'm going to share the class evaluation again. And remember that if you're claiming MLA or CHESS credit, you're going to use that same evaluation.
Joanna made a comment earlier, just a little bit ago, about quality as an accuracy and cultural relevance. The rise of AI has created even more problems, as typically managers who purchase resources have non-background in language access. And I think that's a very true comment I've heard from other people as well.
Thank you for commenting on that, highlighting that comment. All right, Paul and Christine, this has been such an informative session. I want to thank you so much for sharing this resource with us and sharing your work with us. I know this is something that we're all going to use as a go-to resource after this session. So thank you so much.
You're welcome.
With
Thank you
that,
for having us.
yeah. With that, have a great day, everyone. We'll see you next time. All right. Thanks again, Paul and Christine. I'm going to follow up with you two over email, and I'll share the recording with you so you can share it to your networks as well.
Great. I'll send you a PDF of the deck. Does that sound good?
That's perfect. Thank
Okay.
you. Yeah, and I'll send that
Thank
out with the
you.
recording to the attendees. All right. Thanks again for your
Bye.
time. Bye-bye.